I've been sick for about a year, a little over a year. I just had no energy, I couldn't walk, I was just exhausted all the time.
After the 9 hours of surgery they had me in, they had my chest open for 5 hours, closed me up. So about an hour later, if they took a break, they had to come back and reopen me again and go back in for another 4 hours.
Back in 1995, my neurologist had told me to go to bed and stay there. It's too hard to get up into the wheelchair. He told me to go to bed, that my life was about done.
So Phyllis phoned, it must have been in January, and she said, Linda, why don't you come with me and we'll go down to the Black Hills Health and Education Program. This is one of the most beautiful settings that I have been in. Outside my bedroom window, I look out and I see a bird feeder, which has birds regularly. We have turkeys wandering the facility. We've had deer. We've got beautiful ponderosa pine. Of course, at this time of year, everything is just bursting out with green. It's just really nice.
Just the beautiful scenery, and that's one of the things we want. It's a place that would be relaxed and that would be beautiful. But the program, the other guests that we've got to be friends with, and also some key medical revelations that were really important.
The medical attention. We've got at least 2 doctors on site, and we've got several nurses on site, so they're not taking chances with our health, and everything is professional.
And the doctors would follow you back to the nurse, explain to them exactly what the treatment is that they would like to have for you, and then that is transmitted to whether it be the person who's going to be making the teas, the person who's going to be doing the hydrotherapy, or whatever you're going to have. So you are never at a loss to know whether or not the wishes of the doctor would be followed, because they ensure personally that it is done. I find it to be very caring and very nurturing indeed.
The medical program was so thorough. When you come, you get an entrance interview, and they give you some kind of assessment. You fill out some forms, and they take a blood test. And actually, I'm leaving to get back to work, so I had my exit interview just today. And I was amazed that only in 2 weeks' time, I've dropped 27 points of my cholesterol and 24 points of my triglycerides. And I was in fairly good health and ate fairly well, but just the diet and the exercise program while we've been here shown clinical improvement. So I'm really delighted about that.
When I arrived here, I could walk maybe 10 yards. I would say that's how far I could walk without getting really beat.
When I was coming down here, I was asked on a questionnaire, what do you see? Why do you want to come? And I told them I wanted a kickstart to a healthier lifestyle.
One of the reasons for coming here was that I knew I wanted to start back with exercise, but I wanted to have kind of the supervision of a physician, kind of monitoring my increased amount of exercise, being around people who are professionally trained to provide the right amount of exercise.
One of the people that has had an important role in what I've done is my personal trainer. I see the personal trainer at least once a day.
I hear lots of times people like my age who start getting back to exercise sometimes overdoes it, and sometimes, traumatic things happen. So I didn't want that to happen. So I wanted to have kind of the supervision and the care to kind of get back into it.
And my progress is overseen by, the personal trainer, and my program is tailor-made to me, which I find it just profound that because they're doing it for all of us here. That's something that really impresses me with the program.
In the 14 years that my wife and I have been affiliated with the Black Hills Health and Education Center, what we see this is a little haven in a place for people to come where it's a safe environment, where we can teach you how to exercise, we can teach you how to cook, we can teach you how to have different thoughts, how you can change your outlook on life.
We have started a marvelous journey towards good health. We have been exposed to proper diet. We've been exposed to spiritual counseling, and we have been exposed to ways and means of taking care of our mental health. And I think that combination has been so good that we are already seeing huge benefits.
Prior to coming here, I suffer from terrible migraines, and it wasn't an easy task, to deal with, but I did. I dealt with it with my migraines by using medication. Immediately, the doctor prescribed that I do some treatments, and within 3 days, my migraine was gone, which was a miracle in my opinion. And I have been migraine-free for the last 2 weeks, and all I can say is hallelujah, praise the Lord.
One of the most exciting experiences for me is when people set out to make lifestyle changes. And it's interesting how the impact is cumulative. When you start making slow steps and the body starts responding and you make another step and you make another step, these results are cumulative.
We had classes that were specifically designed to address stress. We had an opportunity to speak with a counselor to talk about personal concerns and professional challenges. But another component that was just wonderful, and it really took me by surprise, is we've had regular massages and hydrotherapy treatments. It seems like every other day you get either massage or hydrotherapy treatment. So for an hour, you're treated like a king. And you're encouraged, okay, you need to relax for a half hour after this. And I remember calling my daughter and saying, I've never felt so relaxed in years. It was just wonderful.
I had been a couch potato for some time and had not been doing any exercise at all for quite a while. But being in this environment, what I found is that we can do it at our own pace.
And then the walking is just amazing. And that's what we do here. They highly encourage it, and they walk with you. They don't just send you on. The trainers walk with you. And then what I like about it is that everyone, staff, guests, everyone is bought into the walking. So when you finish eating your meal, whether it's your first meal or second meal, let's go on our walk, and everybody's hyped. And now people walk different lengths, of course, but everybody walks. I'm thinking, this is just amazing.
After I left Black Hills, I was walking probably maybe 2 miles. 2 miles with, kind of slow, and that was throughout the day, little, pieces. But I kept working at that until I got to the place where I can walk 3 to 5 miles in the morning in one chunk.
And the staff is so caring. There are those who can go very fast, and some of us, like myself, are a bit slow. So some staff will take people according to the pace that they can carry, and others will hang back with the rest of us who couldn't make the distance so fast.
Since I've been here, I've kicked it up. I've actually been walking about 6 miles a day, and it has really been wonderful. I thought at first 6 miles, it's impossible. I can't walk 6 miles, and here I am today, 6.5 miles, feeling great.
One of the exciting aspects of following these health principles is that people are finding that they're losing inches off their body. We're not setting out as a weight loss program. Again, all we're doing is cooperating with the way the body's intended to operate. And a side effect of that is we're finding on average 2-inch weight loss circumference reduction in less than 3 weeks.
And the care and thoughtfulness of the staff there is just overwhelming. If they know that we have a need, they would do whatever they can to ensure that it is met.
Another individual that's had an important part is the dietitian.
Since we came here, our nutritionist, Michelle. She has done such a tremendous job in terms of using all natural foods and mixing them into such combinations that we find them to be very palatable.
And again, she is tailor-making her program to help me.
I have thoroughly enjoyed the meals here, especially having someone prepare them for me. You can tell that a lot of thought goes into the meal preparations. Healthy, nutritious, tasty foods, colorful. It's really been a treat to eat this way.
But the thing that we notice here is that everything you put in your mouth, you know, is good for your body. You're not taxing your body to have to break down the simple sugars as opposed to the complex carbohydrates. And so there's a well-being just about that.
But what I've learned that it's not a diet, it's a lifestyle. You need to change your lifestyle.
She's promised us to give us some recipes so when we get back home, we can continue to use those and not have to go to the processed foods. And that is something that I am looking forward to.
I considered myself one who was in fairly good health, ate well, and exercised regularly and so on. But the blood test showed up some things that through supplements and through dietary changes, I can even improve my health. So I'm happy to know those things. In middle age and going forward, you want to be as prepared as you can for those later years.
Probably the most significant change we're seeing in people in a short period of time is there's a 70% reduction in depressive symptoms, less than 3 weeks. They're coming down 70% on the Beck Depression Inventory. This is a scientifically validated instrument for measuring the severity of depressive symptoms. They're coming down 70% in less than 3 weeks by a makeover of their life. And this is helping them get on the road where they have hope, they have energy, they have a new outlook on life. And this isn't just for a short period of time, this is for the rest of their life.
I'm going to be leaving in just a couple of days. It's going to be very hard to leave. It's really a bittersweet experience. We've met some great friends here that we hope to continue close relationships with.
Dr. Olivier is a very compassionate physician, and people are very compassionate, very caring, very supportive, and it's kind of this idea of being surrounded by this community of very caring, supporting people, as well as the people that are coming here. It forms just, I think, a really powerful, almost therapeutic community that makes these changes possible.
I'm told that it is 0.224 miles from the wellness center where we're living down to the lodge where we eat. I was here for a full week, just about, before I could walk down the hill to the cafeteria. I had to have a ride. And then I was able to walk down, and it was almost a week before I could walk up. At this point in time, I can walk down and I can walk back up.
Now I'm back at Black Hills to learn how to help others as I was helped in the past. And I would recommend this program. In fact, I can't wait to get home to tell all of the people that I know about this wonderful program.
I have to admit that at this point in time, I feel better than I have felt in over a year.
I would recommend Black Hills to anyone in a heartbeat. And if you were to ask me, would you come back? I would say, absolutely, I would come back.
It's probably the best thing I've done for myself in years.
Come here and we're going to drink nice smoothies. We're going to walk in the sun. We're going to exercise. We're going to go to lectures and learn about health and learn why we're doing this. And this is a class. You're coming out here to do a class, like a mini training camp, just like us athletes do. We get trained to go forward into our season. You get trained to go forward into the rest of your life.